So, and then, so since Dr. Dar did all these horrible things, and even though she gave me a recommendation for a cardiologist, which was an appropriate recommendation, I didn't take hers because she put a whole bunch of shit in my records, basically, right? So basically, it's like getting if you get a new car, what's the use of a new car if it's filled with garbage, So literally, that's how I have the file name for Dr. Dar's records is basically called Dar Garbage. It's literally garbage. So, and we know that, especially when I have an aneurysm of the ascending aorta, and I have a severe injury to the heart, which is causing the heart to be completely drained of blood, and then severe injuries occurring to the heart because of that, and then some other injuries within the circulatory system with the subclavian artery, the ulnar artery, the axillary artery, and who knows whatever else, until the doctors actually check and do their work. And so with all these problems, Dr. Dar presenting me in this different way, it's going to be really harmful when I go somewhere else. So anyway, and so I called Medstar Family Choice, and I said, I really want that problem taken care of, but I'll just go ahead and try with another primary care. And I did. I got another primary care, and I didn't, at this point, I just want to express it over to a cardiologist. And so, I didn't expect anything much from the primary care except to give me a referral, and he did. And initially, I suggested that maybe, now it turned out the cardiologist he gave me a referral to, Dr. OK, is not one of Medstar's providers, but still, anyway, I thought maybe it was some shady arrangement he had with the cardiologist. But I spoke to this primary care and his practice manager, and I'm convinced that there's no such issue. It's just that he just gave me a doctor on a list, and someone where I can get an appointment right away. And that happened. I got an appointment with Dr. OK within like a couple of days. Now, Dr. OK, what he did is because this is what I'm telling you, everyone knows this. My history is it's going long now because you all are lying a-holes. But really, any doctor, within like 2 minutes of seeing the history, you completely understand what's going on. So this bastard, Dr. OK, obviously understood what's going on. So he went ahead, and on the first visit, he immediately said he wanted to continue the visit on after 2 weeks. Now, I know what that bastard did. What that bastard did is, and then in my story, I only gave that MRI facility name. This time, with Dr. Dar, at least I gave the Innova name. The other time, with this a-hole, I only gave the MRI facility name. And this fucking asshole, it looks like he called, again, I haven't authorized any doctor anywhere to talk to any other doctor. With Dr. Dar, when I wanted her to get my records, I specified which doctors, and that was actually just one doctor, okay? And that doctor was Dr. Dormu, okay? And that's the doctor who did the ultrasound of the arms and found the stenosis. So that was the only authorization I ever gave. And then with this jerk, Dr. OK, I didn't authorize him to talk to anyone. I didn't authorize anyone to talk to him. So he called Capital Imaging, the MRI facility, and it's obvious he called because, and then they send him over to Innova. Again, none of these people are supposed to be having this kind of unauthorized contact. So because Dr. OK, he's a cardiologist, I didn't even mention migraine to him anywhere, and he's got migraine plastered up and down my records. Migraine, all over the place. So here again, whatever I told him, nothing he put down. And what I didn't tell him, that's the garbage he put down, just like Dr. Dar. So, but here's the main thing. With Dr. OK, so this is what I say. These motherfuckers, They know every last detail down to the last little detail. Exactly. Because when Dr. OK did a stress EKG test, what he did is he input into the computer that I was on a beta blocker, even though I was not. And his records from the same day shows medication, none. And we know that even with these records, with these machines, they usually have, basically, you kind of just import those kind of information, so it makes it easier for the doctor. You import all the patient vitals, so forth, straight from your records into the stress EKG test. But even if you don't, but anyway, you would have to go out of your way to type in that the patient is on a beta blocker. So by saying the patient is on a beta blocker, this fucking asshole, he went ahead and set my exercise target rate at 150, and then my resting rate that time was starting up about 115. So you're only talking about 35 beats higher that it has to go, and then he can shut off the test. So this fucking asshole, he knew down to this is what I've been saying all along. These fucking lying doctors. It's very easy. This is first year, second year medical school stuff. So this cardiologist, Dr. OK, he knew exactly when the problem would come up. So he set it up so he can shut it off at 150. And it so happened because he had this cardiology sonographer there, and I was there, obviously. So, I was basically strolling. I was just not even feeling a thing. And so that's when it moved from stage 1 to stage 2. And stage 2, it just got started, and that's where all the problems showed up. And that's where, basically, after 150 beats, that's where all the problems showed up. And then later on, when I asked doctor, now what happened is on the 4th visit, now this was the 2nd visit, and on the 4th visit, I told Dr. OK that I want to get my records for all my visits, including the 4th. So on the 3rd visit, he put migraines all over the place. And now on the 4th visit, when he sees that I'm going to get the records for the 4th visit, so on the 4th visit, then all of a sudden, I don't have any migraines anymore. On the 3rd visit, he put obesity all over the place. And on the 4th visit, all of a sudden, I don't have obesity anymore. So that's incredible, isn't it? All those conditions he put down to satisfy Inoa, they disappeared. And then he didn't give me the interpretation from the stress EKG. What he did is he gave me an interpretation from the stress echocardiogram. Now, of course, the stress echocardiogram, when you have a fucking liar reporting it, right? Because really an echocardiogram, and it should be recorded. So we know the record is there, and I can get it and have an expert look at it. So, but still, the echo is left to the interpretation of the doctor. And since the doctor is a fucking crook and a liar, so he can say whatever he wants. But the stress EKG is an electronic test, and so this fucking a-hole can't mess with it. So that's why he didn't give me that. So when I asked him for that, then he releases a portion of that. And he doesn't give me the part where, he gives me the printout of the parts which came during recovery, and he gives me the printout during stage 1, but he doesn't give me what came during stage 2, because in stage 2, basically it went over 150 beats per minute, and that's exactly all the problem. I mean, the printout basically went haywire, even for the one which came at recovery just after the end of the test. So even that looked really bad. And then on the printout, he also has what the computer highlights, the ST segment elevations. and depressions, and they were really bad. They were all like minus 9.9, plus 9.9. So you know how it is. If you have like plus 2 and minus 9, those are pretty bad by themselves. So minus 9.9 plus 10 plus 9.9, I think they're like the maximum limit. So basically the minus 9 is actually the ischemia going on, and when it's at minus 9.9, it means you have the maximum ischemia, so the worst ischemia. Then the elevations are coming from a combination, it's either or and whatever, of either injury to the heart muscle itself, or actual malfunctioning of the heart. You have some permanent injury which is causing a malfunction of the heart. So that too was at the highest level. So I had the worst findings on a stress EKG. And then he writes on my dictation and on the stress echocardiogram that the stress EKG was normal. Now, he never gave me the interpretation for the stress EKG. He just says that it's normal. So how can it be normal when you're looking at these kind of things? And now, ultimately, I talked to my current primary care. So he's waiting for an interpretation from Dr. OK. So he says he cannot comment about the test because Dr. OK performed the test and he has to give the interpretation. At the same time, I positioned the question a different way and I asked him, what does this mean, these ST elevations and depression? So basically, he gave a list of very bad heart conditions. And then I asked him, what do these numbers mean, the higher numbers? And he said, like everything else, the higher number means the worst. So literally, mine is at the maximum level. So it is the worst. So I'm sitting with the worst finding on a stress EKG, and Dr. OK writes that it was normal. So he's such a liar. So when he got caught, so really, I did my own testing as well. And of course, I did my testing at home. I made it more strenuous than Dr. Ok's. And the difference was my testing at home, it was on a cycle. So since it was on a stationary bike, wow, the difference. So, because really that was going, so really my arms and chest and legs were really helping me to move the blood along. And I guess that's what goes on when I walk or when I do the treadmill. But when I was on a stationary bike, my heart rate went up to 150, which was good. But then when I went more strenuously, when I went towards the peak, my heart rate actually started falling and it fell below even the resting heart rate. So, and the other information I also found out is my heart rate was up for many years. It was after the cardiotoxic injury with the Tegretol in 2003. But Dr. OK likes to present me as though I have hypertension, but I showed him that I've tested myself at home and elsewhere, in other stressful situations, anywhere, and really my heart rate is up. That's because of that cardiotoxic problem, what caused that problem way back then, and also some more doing with the more recent problem. But my hypertension, I don't really have any hypertension problem outside the office. See, so what I proved to Dr. OK is my hypertension problem is only coming in the doctor's office because these doctors are abusing me. And in fact, when I reported to, even after my problems, when I went to Innova, when it looked like they would take care of my problem, I didn't have any kind of blood pressure problem. And then with Dr. Dar, it started to build because of all the abuse she gave me. And then with Dr. OK, it became even worse. So really now what's happening is I have a hypertension problem limited to the doctor's office because it's caused by the abuse by the doctors. And let me continue it to the next tape.